Michelle, the host with the most, here today with your questions by email or to our orders line, 888-212-8871. And we've been having an amazing clearance sale. You have some other announcements, Michelle? Let's roll.
Yes, we have been clearing out a few things that have been stocking up here, like the lactose blocker. I don't know if anyone is interested in taking it. I know I don't take it, but it's been there for a little while.
I spent quite a bit of time talking about this with Ryan.
Yes.
It is the only neutral pH lactase inhibitor. Now, why would people take a lactase blocker?
Yeah, why?
Less than 2% of the population can break down milk sugar. If you don't break it down, it breaks down to glucose and galactose by gut bacteria and grows gunk in your guts, which can make your gut leaky, make you get food allergies, make you have irritable bowel, constipation, diarrhea, or even chronic inflammation.
What type of people would be interested
98% of the population.
But what symptoms or what, people that have like
irritable
diverticulosis or something?
Diverticulosis, irritable bowel syndrome, gut dysbiosis, food allergies, all kinds of things. And a lot of illnesses starts in the gut, and if you've got milk lactose intolerance, the lactose is going to feed abnormal gut bacteria and parasites, etc.
Oh, there we go. I didn't know that. I'm sure most of you out there didn't know that. Speaking of not knowing something, Bill, you know that we have a lot of listeners.
Right.
We found that out from GCN. I guess we're right up there near the top. We know who may be at the top, and we're right there beside. And I guess it's even, the second most expensive to put a commercial on the Nutrimedical show.
That's right.
On the whole network. Well, knowing all of that and knowing all the listeners, I don't think that our sales reflect that. I would say that we have our loyal customers, our loyal friends, that we know who they all are and everything, that support us all the time. And I would say that sitting out there is someone that's saying, ooh, is Michelle talking to me? Am I one of those people that's listening and taking advantage but not even going and ordering one little Vitamin Max? Could that be me? Is God tugging your heart and saying, support us, because we do need your support. And every once in a while, I will say that. I don't like to have to say it, but it is true.
Right.
We need your support to keep us going because this is all we have.
Right. Well, here, let's explain. It's a ministry, number one. They have to understand the NutriMeds we have, compared to any other products sold anywhere, are far superior. There's not even comparison. You cannot sell our nutraceutical unless you're a wellness functional medicine doctor. And there is no comparison to any other nutraceuticals because they're activated. They're trans-amino acid chelates. They're the final activated metabolic state.
Yeah, you're getting the best.
They're heavy metal free. These are the most advanced. We just, for example, launched, as we're doing our clearance, launched the Sports Energy Light. This has taken years of research to develop. People don't realize the amount of time, money, research that's gone on developing these nutraceuticals.
I'd like to thank Ron. You know who Ron is, our friend. He used to live up in L.A. and he's moved to Washington State, and he knows who he is, and he sends us the most awesome articles all the time.
Oh, yeah. Ron is like, he's like a newsomaniac.
He is. Yeah. And he sent this one this week about GNC, Target, Walmart, and Walgreens accused of selling adulterated herbals and vitamins. Do you see this warning and the stuff that's in it? Mustards and all kinds of stuff, because there's no controls, right? There aren't any controls, any FDA controls over what goes in your supplements. So they just throw it. Look at that article. That I think we should post up on our website so that you know why you should go to Nutrimedical and not to your local. And that includes, I'm not going to say their names, but that does include some health food stores here too.
Right, and multi-levels. Okay. A lot of multi-levels are basically multi-level in garbage. We get tons of calls from people that are taking these, quote, other things, and they're saying, we want to support this or that, or we want to do this and that. Look, this is not a home business to take something that's inferior and that doesn't help you or your friends, and you don't have a diagnosis of what's going on, you have no idea of the functional medicine involved, and then you're going to take something thinking you're going to get a miracle. It's not going to happen. And that's what's important. Our NutriMeds are miraculous, aren't they?
So, we got that out of the way, but we're serious. I'm serious about it. I just think that our daily sales should reflect the listeners. And I heard how many we have and how we're right at the top up there. I go like, are you kidding me? We're actually
just a hair behind Alex Jones and Dr. Joy Brown. They're the top. They're at the tippy top.
Doing it,
and we're just a hair behind them in total downloads.
And we've been at this, 7 years? So.
Well, no, we've not been here at Genesis Network for 9 years after being just a few months over at RBN. We were actually 10 years ago we started at Genesis.
Talking about full-time.
Full-time 7 years. You mean like 3 hours a day, 5 days a week.
Right, and by the grace of God. But anyways, I just had to get that out of the way.
Uh-huh.
Because I know that's been bugging you. Because I know how much time you spend and everything.
Well, I spend a lot of time consulting too. And by the way, my consults we do gratis to teach doctors and patients all over the world. Gratis. We just give them the best nutraceuticals. We tell them what medical investigations, what clinics to go to, etc. And it's very rare that I'll say I'm going to charge them $150 per half hour just to do the records. In fact, the last time I did it was 2008.
Yeah, I know.
Yeah, so.
Okay, talking about customers that are loyal, listen to God, loving,
You're funny.
wonderful,
You're funny.
top
Amy.
of my list. No, Richie. Did you talk to Richie from Nevada? This
I did indeed.
And
Yeah.
Richie was. I talked to him first, and then I gave a message over to Bill to give him a ring. But anyways, his test showed recently that he's low in vitamin E and vitamin D, and the question was, what can I take to boost those up? And why is he low in vitamin E and vitamin D?
Well, here's the process. When you start taking nutraceuticals, your body's needs are going to change. You're also going to start mobilizing toxins because you're detoxifying, so you can actually get a healing crisis. For example, if you test somebody who has mercury amalgams in their mouth and you test their mercury level on the QRMA or a PAC red cell test is low, it's because you have to challenge them. And as you challenge, it'll see quite a amount of what's called a sequestered compartment because they're so dangerous, these molecules, aluminum, mercury, arsenic, etc. So his body needs for that on the QRMA test, they're higher because vitamin D is necessary for your immune cells and your stem cells. If you don't have vitamin D, your stem cells don't work and you can't heal your body. And you can't do all kinds of things, regenerate bone, etc.
So should you just up the D3?
Yeah, you take either the drops, which is 1,000 units per drop, and I would recommend you take at least 20 drops a day, or the 5,000 units of soft gel, which I like, and I'll take 3 soft gels at least once a day, or 3 or 4. And then myco D2, because the vitamin D2 from mushrooms is very complementary and has different things, one called ergothioneine, that is present in mushrooms, and it's the initial stimulus for stem cells to start differentiating and healing. So if you take that, and then the vitamin E, you don't want to just take D-alpha tocopherol, which you'll find in the garbage food stores like Walmart and so on. You want to take tocotrienols, gamma tocopherol, and all the other tocopherols. There's a whole range of them, and those are present in our gamma E+. If you take these other toxic forms, you can actually harm yourself and cause more damage by taking D-alpha tocopherol, which is synthetic. So that's easy to correct, and that's the nice thing about the QRMA, which he has. In fact, I'm processing. I just got his email last night after I talked to him, and I'll have that processed by this weekend. So he'll have a list of which nutraceuticals to change in order to optimize his health and nutrition.
And next bill is Henry. Hi, Henry. He's just up the road here, just north of us. And his wife has high blood pressure. She's on lisinopril.
Right.
And he wants to know if it's okay for her to take the Cardivite with the lisinopril.
Yeah, absolutely. I got to explain what hypertension is. And your cardiologist may or may not know this. Your heart does not pump the blood around your body. It's just a primary wave. When your blood pressure is going up, it's your heart trying to compensate for your blood vessels not peristaltically moving the blood. So you want to move from lisinopril to an ACE receptor blocker like Cozar or one of the other ACE receptor blockers. You won't end up with the thing called capitin cough effects, etc. Secondly, take Cardivite. Okay, Cardiovasc is our new name for it, Cardiovasc. You want to take gamma E+, magnesium taurate, and I would recommend that you take Supernox, which opens up the blood vessels and stimulates nitric oxide, along with Bio-LVR as a start, because you need to make tetrahydrobiopterin in your artery walls to produce nitric oxide. So the Bio-LVR is important as a first step. Then you can step up to some methyl, superfolate, pyromethyl B12, but it's a metabolic disease, hypertension, and it's your blood vessels not properly peristaltically moving the blood and your heart trying to compensate.
A praise report quickly from Randy from Florida. He just went to Brazil, and you asked what to take, the Nutraceuticals. I guess it's good for dengue fever? What is that?
Yeah, it's good for anything.
What is that? Some kind of fever? Do I have that right?
Yeah, there's all kinds
or
of...
is that dengue? Isn't that something you put on yourself?
Yeah, I think so.
That's not the right fever, right?
Yeah. Any pathogen you can imagine.
Anyways, he was saying thank you.
Yeah.
Thanks
Very
for
good.
the Nutraceuticals.
You're welcome. Welcome back, and Michelle, you have some more announcements and questions. As then it's the firing line, and I guess I'm in the batter cage.
Remember a couple nights ago that I always take my computer to bed with me on one of these. I don't like watching television, but I love to read on my computer, so that's where I do my reading. My laptop, not my desktop. Anyways,
Unless you're a power lifter.
Anyways, every time you guys, I don't know if your listeners, if it's the same for you, but you see this commercial and it says 5 foods to never eat, 5 things to never do, and all that stuff. Have you ever seen that?
Yeah.
Well, this one was the 5 foods not to eat, and there's always bananas in it and some other stuff, bread. A lot of us know that one anyways. But it said the way to weight loss was green tea and leptin. So I said, Bill, turn that TV down. I got a question for you. So I said, how about the Green Tea Select and the leptin metabolic?
Yes, exactly.
The leptin apparently is awesome for losing weight, whether it's 10
we
pounds
actually have
or
the highest,
50 pounds.
There's a lot of different leptin versions that are out there, but we have the highest concentration of the pharmaceutical grade, right from Europe, leptin metabolic molecule. And what it does is it changes your leptin resistance, which actually makes your body burn off fat. Mm-hmm. It changes your set point in your brain, and it also changes your insulin resistance, so it actually reverses diabetes and obesity. And we combine that with LipoFlush, which is conjugated linoleic acid, and green tea. And the Green Tea Select is what's called a thermogenic agent. So each capsule equals 10 pots of green tea, and it makes you burn calories like crazy. So if you take those Nutraceuticals, and if you have a problem with weight, the diabetoline, you're going to start, 2 capsules of diabetoline twice a day, a leptin metabolic 1 in the morning, and if you're a big person, 1 twice a day to start with.
Just one for an
one
average
the average person, 1 capsule, and I like them because the little red capsules, like take the red pill.
Oh yeah, really?
Yeah.
I have never taken one.
Yeah, they're really cool. And when you start taking leptin metabolic, your body will just start. Even if you don't diet, they actually did studies where people didn't diet, they just started leptin metabolic, and they just started dropping weight.
And the green tea, it used to be Green Tea Supreme, but we found someone else had the same name, so we switched it up to Green Tea Select.
Yeah, I've now gone over some of the other nutraceuticals I needed to educate people on, like Nutrifos, rebuild solid organs, the superfolate, and other things like that. We talked about that yesterday with Ryan.
And the second hour, too, because I am going to now move on.
Moving on to questions, I see.
Let's start with Martin Bill from North Dakota. Dr. Bill, I have been a long-time listener and use Vitamineral Max, Mountain Red, Cardivite, and I also use Calm Mind from time to time and plan on ordering Cognition Plus after I heard you talking about it on your show recently. I enjoy your show and have helped many friends and family with the knowledge that I have gained from it. One of the reasons I am also an organic farmer is your show and your knowledge as well. I am a veteran of the Army and aware of what is really going on today thanks to you. That's very sweet. My girlfriend's father is currently in the hospital for kidney failure.
Right.
Now, he has been in an induced coma and on dialysis for about a week now, and the doctors aren't sure what exactly is wrong with him. He's 63. He's only your age.
Yeah.
250 pounds and 6'5". He's diabetic, high blood pressure, high cholesterol, as well as had heart surgery. The doctors have said they're afraid to do any more surgeries on him, and yesterday a CT scan showed a 9-centimeter mass in his kidney. So he goes while in the hospital. He had 5 medicines for blood pressure.
Why did they put him in a coma, though? What was the reason for that?
He doesn't say. My hope is to get him well enough to leave the hospital and work on getting him on a better diet and the proper nutrients to help him heal. He said before they noticed his liver was shutting down, it says his liver is shutting down, and dilated, his liver is now improving.
Right.
I don't know why they did that.
Well, the first thing is when you have an older person like that, 63, if you overtreat their blood pressure, you decrease perfusion to their kidneys, and their kidneys will shut down as well as their brain and their other organs.
More drugs.
So the research, and this is actually published by the American College of Cardiologists. Mm-hmm. Last year they came out with a new guideline saying if you treat blood pressure more than 140 to 160 over 90, you can cause hypoperfusion and renal failure. Now, if you have renal failure, you have to look at a marker in the urine called microalbumin if you're diabetic. Mm-hmm. If you're spilling it, vein away will reverse that. 2 vein away a day. And ultrathiomin B1 will stop glycation and help return those 2 things. Mm-hmm. If you're trying to improve microperfusion, you want to be on cardiovasc, okay, and you want to take a gamma A+, and you want to be taking things to reduce blood viscosity because it's elevated because of glycation and diabetics. So nattokinase. If you've had a previous heart attack, clot, blocked arteries to your kidneys or whatever, you want to be also on lumbrokinase, which is the enzyme that will actually further reduce blood viscosity. So the important thing is that we can reverse the renal dysfunction. If he has a tumor, what I recommend now is our full cancer nutraceutical protocol. And as I've talked to you a couple of days ago, I did some consults. We're referring people to a clinic in Mexico to do granulocyte therapy for cancer. What they do is they find a first-degree relative with healthy granulocytes and a blood group matching. They take off a unit or two of blood, take out the granulocytes, and give it back by intravenous, and your body will fight the cancer. But you need all our nutraceuticals like Malignablock, Malignarest, Ellagic acid, Inflamax, Micelle D3, Myco D2, etc., and your body will attack the cancer. I do not, as a first thing, suggest, other than surgery for anything like a blocked renal pelvic, we call pedicle, or a blocked artery or a blocked bowel. That's the only time for surgery, or debulking the primary tumor. I never recommend radiation, and I never recommend paint-by-numbers chemo. And if you're going to do chemo, I recommend you do it by gene-based therapy. I really am not keen on it. I don't think cancer is a chemotherapy deficiency. It's where your surveillance system of your immune system is not picking up the cancer and killing it. Because cancer is a survivor cell. It's not a mutant cell. These are strong cells.
Andrew, in an email, I'm looking for advice on how to tighten loose skin after weight loss. Please respond via email, and thank you.
Collagen Max, number 1. Mountain Red Velvet, Tendon Mender are the primary things to tighten it up, and High Dose Power C with full vitamin K2.
Next is Wesley in an email. I had what they call a mini stroke yesterday. I had my left lip go numb and then my left foot go numb, tingling in my left hand and fingers, a little dizziness. It lasted for 5 minutes. I sat down, it went away, and recurred 10 minutes later, lasted 5 minutes again. Went to the hospital, signed in, 20 minutes later had another episode, and had a CAT scan without the dye, and they wanted one with dye. They found a small vessel that had burst. Also, they found what they call a calcified lump in my brain near the burst vessel. Going for an MRI on Monday, May 4th. They tried to give pharmaceutical meds to me, but I refused. I believe that one can dissolve this lump through natural remedies.
Yeah, you can. You use full vitamin K2. Is the most important for dissolving calcified lumps or perivascular calcification. If they form a clot, then you can be certain it's throwing off microemboli. You want to make sure they do an ultrasound of the heart to make sure there's no clots there. And they can also look to see if there's a patent ostium secundum, which is a valve effect in the left and right atrium. 25% of the population will throw clots from their legs or further down. It'll cross from the right to the left atrium and off to the head. If you want to take nattokinase and lumbrikinase, cardiovasc, and omega supreme are the core to prevent new clot formation, and you can check blood viscosity with a blood test called a Rheologics. That's RHEOLOGICS. If you Google that, your doctor can fire the blood off and make sure your blood viscosity is lower. But don't take Coumadin rat poison, Aliquis, Xarelto, or the other toxic, dangerous, and crazy drugs. And welcome back. And Michelle, you have some more questions, and we have hopefully answers that'll get people back on track with their physical and their spiritual health.
It seems just through relatives, friends, lots of people talk about, the last question from Wesley, the stroke problem. I wanted to know, what would a person take to prevent having a stroke when you're healthy and you just don't want to, you want to take something to prevent it? Is it nattokinase?
Yeah, I would start off with cardiovasc and nattokinase.
Keep it simple.
And then I would give ellagic acid.
Okay, but nattokinase number one? Yeah,
you have more that you want to take. Omega cod liver liquid, Omega Supreme will cut down stroke risk and cardiovascular problems with clots by 50% at least, just that one thing.
But if you had to pick one or two, it would be what? Nattokinase?
Cardiovascular nattokinase.
Which is Cardiovite, by the way. He's saying Cardiovasc because since in Canada they can't have ginkgo biloba.
Yeah, ginkgo is very important for protecting.
We can, so we have it's the exact same product, but we just give it a new name because it's the American brand, Cardiovasc.
Right.
So, Bill, that's...
so there's no need for strokes. And by the way, the way to prevent strokes, too, is you have to have good periodontal care. You want to brush your teeth with Silver 100 and irrigate with a hydro floss with Nutridyne, which changes the charge of the particles so the plaque comes off your teeth. You want to get a deep cleaning at least twice a year, because if you have periodontal disease, it increases the risk of stroke and heart attack.
Joe Ao, I think I'm saying your name right, over there in Eastbourne, East Sussex, Great Britain. Hi, Kelsey. Richie Dick said to say hi to you. Hi, sweetheart. Bye-bye.
Bye.
Bye-bye. Richie said, don't lock the door. I said, okay, I won't. Just for him.
Yeah, that's
okay.
cute.
Where am I here? So This is from JOA? J-O, how would you say?
Jiao.
Oh, okay. Hello, Dr. Bill and Michelle. I'm a frequent customer of your products doing the dental protocol and detoxification, spiritual, and wellness. I'm 21 years old, and I haven't been liking the appearance of my skin since I was about 14, 15 years old. I had terrible acne that now, with 21 years, had disappeared but left acne marks. I also have marks due to the sun, a lot of dilated pores all over my face. I really dislike it, and don't. Anyways, everyone thinks I'm older, than he is because of his skin. I was thinking in doing a severe chemical peeling, a deep one. The stronger one would be the one that would make any difference. Do you approve of this treatment, and do you have any other suggestions? And do you have any other protocols? And you can respond to me in an email, but it'd be better if you answer on the firing line because I really need help with this.
There's 3 layers there, 3 things are going on, and some of it you can start with earlier. The first thing you want to turn off the inflammation in your skin, you want to use curcumin complex. It actually will start the healing process.
Mm-hmm.
The second thing, you want to take collagen max. It'll help to rebuild the collagen and elastin in the skin,
mm-hmm.
and hyaluronic acid, so you'll have less scarring and pores. Third are vessels. If he's had small vessels, we call basically spider nevi and other things because he's had acne and inflammation, you want to take vein away. It'll actually make varicose veins and veins in the face and small vessels, like we call spider nevi, disappear. He may want to see a dermatologist and have a laser treatment for scarring and so on, or deep peel. But you want to see a dermatologist will do that, or what's called hydroxy acid peels. But I'd see it under a dermatologist. Don't do it on your own. No. But the other nutraceuticals I mentioned are going to dramatically improve his response, even to the deep peel or laser treatment for any acne.
Here's his problem. He said he's been to a lot of dermatologists and no one gave him the results he wanted. He used a lot of different products during his teenager years, always promising results and nothing. So I guess what he wants to know, the chemical peel, a real strong chemical peel, is that any good?
Well, the chemical peel will peel off, the outside skin and helps to smooth it out a bit. Mm-hmm. I'd only do it under a dermatologist. Don't try to do it on your own. But the best treatment for scarring is laser treatment.
Laser, okay.
Laser, and you have to use that. By the way, laser you have to use it with collagen max, with the curcumin cream, and with taking vein away, which will help get rid of abnormal vessels in the skin. Because when the skin's been chronically inflamed with acne or the scarring or sun activity, you get sun damage. You end up with weak activation of vessels that try to heal. So you get these, tiny little vessels we call nevi, spider nevi, etc. Yeah. And the vein away will actually make those go away. So I would say, see a dermatologist, get laser treatment, and combine that with those specific nutraceuticals, and it'll help. And if you're trying to heal skin, you want to use Nutrafos as well to help rebuild the skin tissue, the Nutrafos.
Next is Tim from Virginia. Hi, Dr. Deagle. I'm writing on behalf of my wife, Maria, regarding her mother. She called you recently about her mother and was very excited to speak with you. She was likewise very happy that you recognized her personality in such a positive light. You called her a dynamic person, which had her walking on clouds for days. LOL. I appreciate it very much because she is one of...
She was a character.
She
was a character, right?
Listen to this. He sounds like it. Yeah. I appreciate it very much because she is one of a kind, in my opinion, and you are her Beyonce, so to speak. We no longer pursue the mainstream in any way and are constantly fighting its programming. So again, oh gosh, that's all. It's too much mushy. Yeah, here we go. Her mother has been showing the first signs of dementia for about 2 years or a little more now. She would always be very coherent, but would consistently ask the time of day over and over, for example, and recently she had a fall. And Maria spoke to her on Thursday evening, and then on Saturday morning received a call from a friend of the family. I guess she had a bad fall. They were knocking on the door, and anyways, she's ending up in the hospital here, Bill. She arrived at the hospital fairly dehydrated and with a urinary tract infection.
Right.
So I found her blood in the toilet. We drove up, and I guess, do you want me to read some more of this?
It sounds pretty long. Can you summarize?
On top of all this, Helen, that's her mother's name, was involved in a bad car accident which severely hurt her leg in the 90s. They put an iron rod in it.
Right.
The injured leg was shorter than the other one, so she had special shoes, and we believe that leg has grown back at her, or at least evened out a bit, and think that her custom shoes may be exasperating her leg pain. She's got a few things going on. The biggest one is the dementia, though, Bill.
Okay, well, the first thing with dementia, number one, what is dementia? The most common cause of dementia is diabetes of the brain. When your astrocytes, your brain cells, actually get insulin resistant, you can't generate an action potential in a neural network. Mm-hmm. So the first thing I recommend is you start giving her Cognition Plus and Brain Power. You start giving her mitochondrial support with CoQ10 and Vascu Care.
And you can open those capsules.
You can open it. You can make a smoothie. You can become the barista. And then the second thing is that you want to help remyelinate her, so you want to give her Neurogen and Nutrifos. And you can also even give her Sphingolin, which is the beta-myelin protein for remyelination. Most people aren't aware of this, but seniors, when they get their brain on fire, BOF we call it, you want to take Nutrichala, Cell Detox Glutathione, and Regenerex. Mm-hmm. And you want to take phospholipids to remyelinate the brain because it's getting dysmyelinated. CoQ10 and Vascu Care are extremely important. Mitocarnitine, mitochondrial catalysts are really important for improving mitochondrial function. For brain inflammation, we call Alzheimer's, Brain Mag, and the new product which we're launching, which is called the Sports Energy Lights. If you mix Brain Mag and Sports Energy Lights and give her drinking that and sipping it all day long, you'll improve her brain function. And they've even proven it'll stop neurofibrillar tangles, the Brain Mag. The magnesium L-threonate and magnesium glycinate malate will actually stop it on pathological studies, so it's already published.
After the injury to her leg, her doctor prescribed blood pressure and cholesterol pharmaceuticals.
Right. Oh, boy.
Maria wants to know what she can...
Well, let me explain. We had Dr. Graveline, who is a NASA MD doctor, and after he started within 3 months, he started having neurological decline, and by 6 months he get transient global amnesia.
After starting what?
HMG-CoA reductase inhibitor for cholesterol.
Oh,
it dysmyelinates your brain.
They put her on cholesterol.
Yeah, what it does is these drugs are dangerous, and they should not be given to any human beings because what they do is they interfere with CoQ10 metabolism in your heart. Mm-hmm. And they also, 60% of the dry weight of your brain is cholesterol or cholesterol-built molecules.
So no wonder.
So you get in patchy dysmyelination, you lose your neural pathways for saltatory nerve conduction, and you actually become demented. You can actually make some demented just on HMG-CoA reductase inhibitors. They've also proven it takes women and makes them diabetic.
So there's an answer to where the dementia came from.
Right, and if you overtreat their blood pressure too, you decrease brain perfusion. Mm-hmm. So you want to make sure you're perfusing her brain, not just lowering blood pressure. So I can put a program together. We can also use other things as well as other technologies to improve brain function.
Here's her email, and you can email her.
Including things like micropulse and lumen photon and mild hyperbaric oxygen.
Do you have...
And welcome back. And Michelle, you have some more questions, and we have some answers to get people well and to not only get them well physically but spiritually.
Griselda in an email. My name is Griselda, and I was referred to you by Carla B. Won't say her whole name. I am 54 years old, and I'm experiencing digestive and constipation issues. Please tell me what you would recommend.
First thing, you want to normalize the peristaltic movement of the bowel, so you want to take IBS-Care. It is a special form of carnitine that is a slow release to normalize the myenteric plexus in your bowel wall. Second, you want to take a probiotic, living probiotic, which is a Rizal 6 strain. That's our standard from the Pasteur Institute in Paris, France. And then you want to take living probiotic ultra every third day. One capsule. It's in a nitrogen sachet. You want to take a Gastro Heal to heal the gut wall, which is zinc carnosine. Chew one tablet 3 to 4 times a day. Mm-hmm. And you want to take things antipathogenics, berberstatin, 2 capsules twice a day, and an Allicin Med, 1 capsule twice a day. I can also recommend you can add Silver 100 spray, 1 spray per 10 pounds body weight 3 times a day in the mouth, rinse, and just swallow. And you can brush your teeth with it too, and brush and then swallow. Mm-hmm. What that'll do is kill off the pathogens, heal the gut wall. One of the best things to heal is also to take the ageless drink, which has the immunoglobulins, the rice protein, the other things to heal the gut wall, the ageless.
Sherry from Ohio. Hi, Michelle, and hi, Sherry. I know you're out there. Sherry here, got a question. Do you carry a product that contains
methylsulfonomethane, MSM.
Or MSM plus C. It is supposed to be good for arthritis. Blessings from Ohio.
MSM is something I would have used about a third of a century ago. It's replaced by glucosamine chondroitin back around 35 years ago. And we have something far more powerful. We use right now the Joint Performance, which will regenerate your joints, Tendon Mender for the tenocytes and the connective tissue, Collagen Max, and Mountain Red Velvet.
tell me one time there's chlorine or something in that MSM?
No, that's another one.
That's a different one?
No, that's a different thing. That's basically
what is MSM?
MMS.
Oh, that's MMS.
Yeah,
okay.
chlorine dioxide.
And this is just a nutritional supplement?
Yeah, methyl sulfonamethane is a muscle donor. If you're trying to rebuild your joints, the first thing you want to do is take Joint Performance, Tendon Mender, Collagen Max, and Mountain Red Velvet. And then if you're trying to increase methylation, you want to support it with BioLVR, Samethyl, the highest concentration nitrogen sachet, SS 77% isomer of acetylmethionine with 600 milligrams of trimethylglycine per sachet, superfolate and power muscle B12. But most of the time, all you need to do is start off with Tendon Mender, Joint Performance, Collagen Max, and Mountain Red Velvet, and you regenerate your joints.
Janet, hey Janet from Georgia. Hi Michelle. This may be too late to get on your show today. This was sent on April 24th. Just missed it there.
Right.
But I had a quick question I'm sure Dr. Deagle can help with. My son, who is 15, was diagnosed with Brown's syndrome in his right eye when he was an infant. We tried one surgery where they lengthened the tendon, but we didn't really see any change. Do you have any ideas or suggestions to help him naturally?
Right. Well, you're talking about Brown syndrome, where basically she has a congenitally short extraocular muscle, right?
Yeah.
Well,
he
has Brown syndrome, right? Basically, I'm just going to pull up some of the information on Brown syndrome. It's a rare form of strabismus associated with limited elevation of the affected eye, so the eye will not lift up, so one eyelid is kind of turned downward.
So is it kind of like a cross eyes?
No, not cross. It's a vertical one. Brown syndrome is not lateral. You know, like for example, our son Chris had a mild strabismus, and he had the surgery and fixed it perfectly. It's a little different syndrome. So what do the doctors offer? What do they suggest? Did they offer anything?
She just wanted your idea. Well, she said they had the surgery, but it didn't see. She said she didn't see any change from the surgery.
Well, it's my suspicion that when you get a strabismus, it's a form of motor or myopathy of the extraocular muscles, and so all myopathies are tied back to mitochondrial dysfunction.
But what about another surgery to try again? Do you think?
Yeah, I would say there's probably more advanced surgical clinics. So you might combine surgery with nutraceuticals. Firstly, you want to support muscle or myopathic function. You want to give Vascu Care, which is a propionyl carnitine, CoQ10. And you want to improve muscle fiber activity, Collagen Max, Mountain Red Velvet. Those would be the core ones to start with. Mitocarnitine, mitochondrial catalyst, and uridine. And they'll reverse myopathies. So the most likely thing is he has some form of extraocular myopathy, and it's affecting the muscles that allow, it's called the levator muscles that elevate the eyeball. And rather than the extraocular muscles that pull the eye laterally. And that's why you'll get, it's a vertical strabismus is what it is.
Mm-hmm. Yeah, remember little Christopher said, there's a pirate in the house, We tried the patching.
Yeah.
This little eye.
Yeah. He was cute.
For 6 months, and we said, okay, we'll do the surgery.
You see the picture I've shown here, right?
You have to have it was cute.
You see Brown syndrome there, right? You see where one eye is
I see.
Yeah.
Bill?
Yeah.
Next is Gail. Hey, Gail, from Dunedin, New Zealand.
Right.
And Gail says, hi, Michelle. Thank you very much for your hard work. We also really appreciate Bill's insight and up-to-date info. She goes on to say about what she was going to order, and the question I have, in Australia, didn't we get an email from someone that said they couldn't have iodine there anymore?
No, it's not there. They're trying to do it in Australia.
But not New Zealand, but it was Australia.
They're trying to do it. We can still slide it under because we have small little packages, so if you're ordering it, we can still get it there.
Yeah, I know. We're still sending it to Australia a lot because people are getting a little nervous that they're not going to be able to get it. But what was that about that you couldn't have iodine?
It's related to the Codex Alimentarius. Do you want a little history of it?
Sure.
The Codex was actually a plan put together by the pharmaceutical industry with a convicted Nazi war criminal in the 1960s who was in prison. And while he was in prison, he actually thought up this idea of a codex, which is basically a codified way of making sure that only drugs could be used for treatment and not nutraceuticals. Mm-hmm. So the Codex Alimentarius would say you can't give vitamin C at dosages we give like 500 or 1,000 milligrams or more. You have to give microscopic dosages, and then anything more than that would be considered a form of malpractice.
Boy, California sure takes that serious, don't they?
Well, you're talking
They
about
have warnings about everything.
Prop 65 in California
ridiculous.
basically is all vegetables grown, whether organic or not, are going to have trace amounts of heavy metals, especially lead.
Yeah, and then Sprouts and Trader Joe's has warnings on all the foods. It's just ridiculous here.
At the same time, they actually have medical assault where they force vaccinate children with heavy metals with mercury, ethyl salicylate, aluminum, which is now doubled in the new Gardasil vaccine, and they're going to get their pantsuit off because there's a number of wealthy and smart parents that are going to sue the schools, the doctors, and nurses, and they're not just going to lose money. Some of these people are going to go to prison over it.
But I must say, the state that I loved, in past tense, the love is dying, when they forced vaccinations and they did all this other stuff lately. And next thing you know, they said with the drought, you can only have 2 showers a week. Well, I mean, this may as well live in the gulag.
No. Well, I actually welcome this, just like Jade Helm. Jade Helm is actually to frighten people to say they're going to start going after patriots. I think it's a fantastic deal. I am so glad and proud of them finally doing this, because it's going to take people that are apathetic or don't believe what we say. You know, I've been saying on the show for a while that I can do this in an hour or two. But
do that in an hour or two.
I'll do. I got a rant. I'm just waiting for an hour or two.
You're just taking a big drawing in a big lot of air. I can hardly breathe.
It's like Jackie Gleason, you know, with his friend Norton, right?
Yeah. I can't breathe.
I got a Gleason rant ready to go. Go ahead.
When I can't breathe over here, it's because you're sucking in to get ready for a long one.
There you go. pulling all the oxygen in the room.
Save it for the second.
Oh, yeah. Vaccine mania.
I'm trying not to talk at the same time that you do.
That's good, so that people can hear.
Yeah. Oh, Dr. Ken. Next is Dr. Ken. He's our MD from North Carolina. Nice talking with you, Dr. Bill, a few days ago. As you suggested, I am writing to ask you for the contact info for the Mexican clinic which does the leukocyte therapy for cancer. And also the name of the lab test you mentioned, so you need to send that off to him.
Actually, I had several people. I think I'm going to post it up actually under wellness conditions because I've had a number. It's going to be a special cancer protocol, and it's called granulocyte therapy. What they do is there are clinics, several clinics like in big cities, but the main one is Tijuana. There's several clinics.
To do that, Bill.
They do cancer vaccines as well as Laetrile, and they will make the granulocyte therapy. They phoresis or separate the granulocytes from a first-degree relative. They're blood matched. Infuse it in a person with cancer, and it rips the cancer primary and secondary. No chemo necessary. Maybe Laetrile B17 intravenous and some other nutraceuticals. Our nutraceuticals with that, and you're all set.
Well, everyone, have a wonderful weekend. God bless you. We love you. We'll be here next week. It's always a pleasure. Hey, Bill?
Yes, and I'm glad that you kind of told people, hey, don't go elsewhere for your Nutrimed needs.
Oh, support us, please. We're begging you. I'm not quite on my knees, but I'm begging you.
Don't waste your time and money and put yourself in danger by getting things elsewhere.
Yeah,
no matter how.
That's the thing.
It's a multi-level whatever. Don't be foolish.